Hi, my name's Steve Paget. Let's talk rheumatology. So the American College of Rheumatology meeting will be coming up in next few weeks in San Francisco, and I know we all look forward to it. It's an 8-ring circus, but we love it. It's part of being a rheumatologist. So I've reviewed the over 2,100 abstracts in the abstract book, and I'd like to give you my thoughts about some of the highlights. When we meet at the meeting, maybe we can talk a little bit about them. Some overview points. First of all, genetic profiling. Well, it's clearly the wave of the future, maybe even our current concept and care. But both profiling genetically and also from a cytokine and immunological point of view will become a regular part of our practice and allow us to assure specific diagnoses, who will respond or not respond to a therapy, and if they are responding. This is very impressive stuff, and I think it'll make our care of our patients better. Vitamin D. It's amazing how common vitamin D deficiencies are in our patients with systemic autoimmune diseases. And so in every one of these patients, I send a 25-hydroxy vitamin D level, and if the level is below 30, I treat it. Let's move on to rheumatoid arthritis. Lots of abstracts on the biologic agents with regard to their long-term safety, potential side effects such as infections and even malignancies, although we still know that these medicines are surprisingly and wonderfully safe, although we have to understand the pluses and minuses of them. Let's talk about the use of anti-TNF medications and the possibility of developing tuberculosis. So in the past we would do a 5-TU PPD. Obviously it has to be done intradermally, because if it's done subcutaneously, it's really ineffective. And what often happens is our patients call in the results or have it read outside by people who don't know how to read it, and thus the test is really ineffective and really doesn't help from a safety point of view. From my perspective and my division's perspective at HSS, the quantiferon assay is both highly sensitive and specific, and I think it should replace the PPD. There are amazing new small molecules which can be given orally that suppress MEK or MAP kinase or JAK. And all of these have shown some effectiveness, although we'll have to see what the effect is upon the immune system with regard to infections with these medications. The issue of atherosclerosis in lupus and rheumatoid arthritis, a real important issue because there's an increased incidence of that. And it's nice to see that some of the anti-TNF medications have been shown to decrease the incidence of cardiovascular problems. That's a wonderful thing for our patients. With regard to lupus erythematosus, it's interesting that patients are showing increased end-stage renal disease, particularly blacks. And so we have to be very, very careful with our African American patients and be appropriately aggressive and understand that for various reasons, they have a worse prognosis. There are many therapies that seem to be effective in lupus, including many of the B-cell therapies, and also some updated information on the use of mycophenolate mofetil. And thank goodness we have new medications for lupus and our patients. Moving on to the spondyloarthropathies, the anti-TNFs seem to work very well there, although we still have that issue of the optimal control of inflammation, but not specific joint damage or joint abnormalities as defined by MRI. We'll have to see more about that, both at this meeting and in the future. Regarding scleroderma, a horrible disease, and while we have improved the outcome with the use of proton pump inhibitors and ACE inhibitors and ARBs, and also the ability to control pulmonary hypertension, we really do need a disease-modifying drug in scleroderma. And there are a few excellent abstracts this time about the use of Gleevec, a drug that's previously been used for chronic myelogenous leukemia, in scleroderma. Let's check that out. In osteoarthritis, there are many abstracts relating to epidemiology and clinical issues, but alas, there are no good disease-modifying drugs for that disease which affects so many people. So I hope to see you all at the meeting. Your look at the abstract book may be a little bit different than mine, But one thing's for sure, there's going to be a lot of new information. Safe travels.